Hi everyone, my name is Soraya. I am a YouTube creator and I talk about health, wellness and skincare, especially acne in regards to skincare. Welcome to my channel. Today I'm gonna be talking about anemia. I have had anemia for quite a while and I want to give you a tip, or maybe one or more tips about increasing your hemoglobin or blood levels so that you are healthier in terms of having enough like blood going through your tissues. So I'll start from the beginning so that this is not complicated. This is anemia is a condition where your hemoglobin anemia is a condition where your hemoglobin, which is in your red blood cells, hemoglobin is a protein which is in your red blood cells and carries your oxygen to your tissues. When I say tissues, that means like your liver, your heart, your legs, all these things that make up your body. So when you don't have enough hemoglobin, then depending on how like what type of hemoglobin, your type of your red blood cells, and then your other things, there are different kinds of anemia. So for me, I am iron deficient. There are different kinds of anemia. There's one which is because of iron, there's others because of vitamin B. There are so many things that make the blood cell or the hemoglobin, and all of these things are the ones which may affect the development of the hemoglobin. So for me, my hemoglobin is not able to get the iron, and rather the iron is lost very quickly. I have a condition where I bleed a lot, and I have very heavy periods, so that's how I lose my iron. So it has been going on for a while, and if you see, I'll put a clip of a video of where I talked about my iron deficiency anemia, but it causes me to have headaches, dizziness, sometimes shortness of breath. Not really, but the shortness of breath is especially with exercise, like when I'm trying to walk a hill or walk very fast. I really get short of breath very fast compared to other people. Hair loss is also part of that, and it has been going on for a while. I've been anemic for quite a while. I have had to get blood transfusions, especially if I, like in emergent situations, when I have to, maybe I'm sick and I have to get my iron levels improved, then sometimes they've had to give me blood transfusions. There was a time my hemoglobin was at I think 6 or 7. So, and that was the time that I realized I was very anemic. Like I would go around just thinking everything is normal, like this fatigue is normal, I'm probably not putting enough work, the headaches are normal. But when I did and this is like a long time ago, maybe like 20 years ago. I'm old, guys. So yeah, I went to the lab and they told me, oh, my hemoglobin is like 6 or 7. It was between 6 or 7, and I'm like, oh my god. Yeah, that is quite low, because I know what that means. So I'm like, oh my god, maybe I need a blood transfusion or something. So yeah, I mean, so that has been going on. So I've been, since then I've been trying to track my iron levels. My symptoms are not as bad, because at that time I was getting very severe headaches, and I was bleeding a lot. My bleeding is not as much anymore. I still bleed a lot, but not the way I used to bleed. So now the headaches are a little bit better, and because now that they were kind of improving, not improving so that it is at normal, but better than how it was before, I was just dealing with it, managing it. So what I would tell my doctors is that I know I'm anemic, and they'd give me oral tablets for me to take so that I can boost my iron. which it didn't really, I didn't feel like it did much for me symptomatically. Like, I knew that taking it would at least help in some ways, better than taking nothing. So that I would take it like every day, every other day. I would take it like a supplement, not really like seriously. I should take it seriously, but that's how I still take it like that. I like taking it every other day, because I like to take things, I would rather take things from my food than as a supplement. So I also was trying to increase my vegetables, increase my protein, my meat, my liver. So what, like, sometimes you slack, and you're not able to do these things, and then you remember, and then you start eating more of them. That's just up and down. Life is busy sometimes. But it's always at the back of my mind that I am anemic, and so I have my iron tablets that I've been taking, and they had also suggested at some point some folic acid. So yeah, I would take that every day or every other day. I was also taking some multivitamin, just because I would be able to get my vitamin B and my mineral elements, which are helpful in producing your proteins, which is partly the hemoglobin, which is gonna be helpful in your overall, like, function of my body. So I would do that. And recently, I decided to do, maybe was it 2 or 3 years back, I decided to just, I research, once in a while I'll be researching about this hemoglobin. And I mean, I know these things, but in regards to me, I just don't know why I was not taking it seriously. But I think because I was functioning well. So if you're functioning well, you're like, let me check my iron levels, like, to see how low is low. And when they checked it, I think on my annual exam, which is why you should go for your annual exam, my iron levels were low, and my, what they call, ferritin levels were low. So when I checked my ferritin levels the first time, I knew it was low, and I'm like, oh my god, it was very low. It has been like between 2 and 4, I think. And then I repeated it again after a year, and it was at 4. So I knew for sure that I'm iron deficient anemia. So now with my annual exams, they had started now to take that seriously, and giving me my iron tablets for me to take. So I've been taking that. And then when they repeated it again, my iron level was still at 4. And I think this time I was also getting the dizziness and the headaches were starting to come back. So I decided, let me research more about it. And in the process of researching, talking to my family, talking to my friends, there was an option of doing iron infusions, which I think I knew, I have seen, but I don't know why I didn't think it could apply to me. But I was like, you know what, yeah, I really should be able to take iron infusions. It's not, maybe because it has not been recommended for me, so I didn't think that it was necessary. Because sometimes the doctors just like shoo, they're like, oh, you're fine, you're functioning well, so you can just continue taking the tablets. But I'm like, this person took iron infusion, that person took iron infusions. And when I read on the internet and things, they're like, this is one thing that you can do. So I was like, okay, so let me ask and see if I can get my iron infusion. So the next, I think last year is when I talked to my doctor, and I was like, you know what, I do really want to take iron infusion, so that I see if that will help with me improving my hemoglobin levels. And so that is how I advocated for myself. I was like, you know what, I think I should do this, so I'm gonna ask for it. So of course, then they will tell you, oh, it's something to do with insurance, so it has to go through your insurance. But I feel like if you've had it documented for quite a while that you're anemic, so the insurance is aware that you're anemic, and you have tried the oral tablets and you're still anemic, then there's there's a case for you to do the iron infusions, which was for me what was the case. So I did, for me, I don't think getting like insurance authorization for the iron infusions was a problem, because it had been documented for quite a while. So yeah, it went through the insurance, and then you have to be careful, because there are some insurances where they had wanted me to do like home infusions, which would have been, well, convenient because they would come at home, but for me, I wasn't very comfortable with that. Then also the insurance was gonna be more expensive than me having it done where I work. So I decided to wait and have it set up where I work, because it would be easier and faster for me to get the iron infusions that way. So so it took about, maybe for the insurance, maybe a month or two to sort out, and then I started getting the iron infusions, which I'll also put in maybe one of the shorts here. So what happens is that you go to the infusion center, and they put in an IV in your hand, and then a catheter, like a one for getting fluids, and then they give you the IV iron shot. It's not, for me it was, I think she had told me it was 200 grams. I can't remember which one she said, but usually they give one called Venofer. I don't know if that one was the one I was given, I can't remember. And it looks brownish orange. The thing that you should know is getting the IV can be painful, depends on you, and then also the Venofer infusion can be irritating to the veins. So for me, it was, the first one was tolerable but burning me, so I learned from the first one. It really made my vein painful. After that one day, I had to wait quite a while before I used that hand. But I let the nurse know the next time. So the next time they did put in some saline together with the iron, so that it made it less irritable, and then they flushed it with a saline bag. So you can get it that way. You can get it just like a shot in one go, which takes less than I would say maybe 5 to 10 minutes, but usually it's less than 5 minutes, and then they flush it. Or if you have irritable veins, they put it through the IV, then they'll hang a saline to flush the iron out of the vein. Sometimes they, like in the hospital, they may run the iron and the saline together, so that it's not that irritating to your veins. So yeah, that's what you should know about the iron. It's less than half an hour that you take. The rest is just like admin, getting your vitals, height, blah blah blah. You're in a small room, they give you the iron infusion, they'll monitor you after to see if there's any allergic reaction. For some people, they do get allergic reactions. So yeah, I didn't have any allergic reactions. They did tell me that I might have headaches, but I really didn't get any headaches after the IV infusion, or even at home. I didn't get any headaches. So I did that just because it was very irritating to my veins. I was like, I think I got 5 infusions, so I would like schedule them a few days apart. So maybe 1 or 2 infusions in a week, and I did that for about in between 6 weeks for me to get all the 5 infusions. So I did that, and then the doctor said that they would monitor me. So after about 2 months from the last infusion is when I did another blood test, and the blood test came back. So I felt better. I felt that the IV infusion, the iron infusion, helped me shed less of my hair. My hair really grew in where it was not growing, it grew. That was for sure. I had less of the headaches, and I felt less fatigued, less short of breath. That's all I can say. It didn't really stop the cause of the infusions, like my bleeding. I was still bleeding the way I was bleeding, but it didn't lengthen the bleeding either. So it didn't work. It didn't really affect that part. So after when I repeated my iron levels, my iron was my hemoglobin was 10 and 34, which was the same as the previous year, so that didn't change. I don't know. and my iron levels went up from 18 to 60. So my iron increased. And 60 is still like the lower normal, and 29 is also the lower normal of the levels that it's supposed to be. But at least it was not like extremely low. So I feel like it did work faster, of course, than the iron levels, because my the previous 2 years there was no change in my oral, like me taking my iron pills didn't really change it. My, especially the ferritin and iron part, it didn't really change much of that. So I don't know if the iron was just not working or it was just like maintaining it. I'm not quite sure, and I don't know now. I'm still taking my iron tablets. Sorry guys, I just had to change position a little bit, but I want to finish this. So I wanted to say, like, it increased my iron and my ferritin levels. So I think it did benefit me, and I feel less tired. I really felt less tired. I felt like I was able to function a little bit better. This now has been about maybe 3 months or 4 months post the IV infusion. What I can say now is I feel like the effects of the IV infusions are going away. I do feel that my hair is shedding a little bit more, which I think is a sign. I have some shortness of breath with exhaustion, but it's not as bad, but it's there. I haven't had dizziness yet. There's only, I think, one point when I felt dizzy. And fatigue, well, fatigue, I don't think I feel as fatigued as before, but I feel like it's coming back. So I feel like the IV infusions are good, but also still temporary, but better than the oral tablets that I've been taking. So I just wanted to just document for people who are anemic and maybe would like an option of how to treat the anemia, to consider iron infusions. Just make sure that you're able to get it through, especially if you're in the United States, that you can get it through your insurance. It's gonna be cheaper, especially if they're gonna be able to authorize it for you, and then take advantage of that, and it will help you in the long run. Of course, you have to look out for the cause of it. For me, I know what my cause is. It's in the middle of treatment of it, so I don't want to go into that for now. If you have other things, because sometimes iron may be because you're not eating enough, maybe you have malabsorption, maybe you have parasites, and you can also look up some YouTube channels which talk about this. So you have to find out what is causing your anemia and then treat it accordingly, and that is also in my video. I had talked about anemia. For me, I think I don't know what the hematologist will recommend. I know I am following up with the GI doctor to see if there's any problems with my malabsorption too. But I know I'm gonna have to follow up with either my primary care or a hematologist to get other iron infusions, probably I don't know, if maybe next year. I don't know if they'll be able to agree to do it this year, because they already got some infusions for me, but I'll see. We will see. I don't it will depend on what's going on in my life. And you can also get it through privately. Like if you're in other countries like Kenya, you can ask the doctor if you're able to get iron infusions, and they'll may tell you the price and how much it will be, and what you can, like, how you can get your iron infusions. So yeah, the other thing is, as I said, like, continue eating iron rich like food or vegetables. You have to eat your red meat, not in moderation, not take too much, but just enough for you to be able to improve your red meat, because red meat is also associated with a lot of cholesterol, but you can take it. It depends on how you take it. I rarely used to eat meat, so for me, increasing my red meat is not a problem. You can do it through vegetables. There are different vegetables that can give you iron. I'm gonna say one of them, which is spinach. The other is beets. Beets are very good in increasing your hemoglobin. And then also you can do it through, of course, the tablets. There's some I will be trying one through the syrup, which I saw recently. It's a black molasses syrup, so maybe I will update you on that when I do get that. On one of the Facebook groups that I am on that talk about iron metabolism, they recommended the black molasses syrup, and I have seen it on other YouTube videos. So I would like to try that and see if it's gonna be easier for me, or even more palatable or not for me, if I'm gonna be able to stand it taste wise, and then see how that behaves. Meanwhile, I'm taking my iron tablets, and I'm eating my vegetables and my red meat at times, and yeah, I think that's what I'm doing really. And we'll see what the doctors say, and I hope that this video is gonna help you guys. Remember to advocate for yourselves. Don't feel like your anemia symptoms are just normal. I mean, for you they may just be normal and you're just functioning and, you know, like treading through your life, but you can have those go away. It's just the same way like with period pain. Some people feel like, oh, just because I don't have pain as much as the person who's cramping and has to go like home from work means doesn't, you know, like I can manage, so I don't need to do anything. But pain is pain. That's why you have pain medication, so you don't have to suffer through your pain when there's pain medication. So take your pain medication, take things that will help you relieve the suffering. Advocate for yourself, be able to get your iron infusions, get your iron tablets, take your make sure you're taking your supplements, especially your vitamin B, your zinc, your selenium, magnesium. There's so many things that are related with vitamin deficiencies, so please make sure you're taking that. If you think you're having some malabsorption, you're like, you have, some people have like irritable bowel syndrome, like constipation, diarrhea related to different foods, you might need to talk to your GI and see if you need a colonoscopy or an endoscopy and have that treated so that you're able to absorb your iron and other vitamins. But don't take yourself for granted, you know. Just be able to make sure that you're keeping up with your health, because there's a cost to that. Like if you're not taking care of your health, you'll find yourself in the hospital, you might get complications, you might need a blood transfusion, which maybe you didn't need in the first place. So if you're able to prevent it, then do so. And that is why my channel is here, so that you're able to prevent these things from becoming worse and spending more and having complications at the time when it's not really necessary. So take care of yourself. It's been good to see you. Please subscribe, like, share my channel, and please leave a comment. Tell me what you want to hear about the next time, and I might add a few. Watch my shorts, and but yeah, I hope you have a lovely day. I hope you're able to go through my playlist and look at things that may help you in your health journey, and I will see you next time. Bye.